kind of epidemic which is running across the society. It's a very important disease for us to treat, identify as well. So there are certain identifying signs which come along with the stroke. So I think I would like to ask Dr. Abha to inform us regarding those signs.
Every individual should be able to identify the early signs of stroke. So now this can be very easily remembered by the mnemonic B FAST. So B refers to balance, sudden loss in the balance. E, eyes, so sudden loss of vision in any one eye. F, that is face. So sudden deviation or drooping of one side of the face is another symptom. Then we have A. A refers to arm. So sudden weakness of one arm or one leg. Then we have S, that is speech. So sudden slurring of speech. Sudden that patient is not able to speak at all. Or
that would be to recognize the importance of the B FAST mnemonic. Another way is also to do something called as Namaste. In India, we are tuned to have this Namaste as our greeting gesture wherever we go. So when we do that with a laughing face, if we have any of the abnormalities associated, that also helps us in detecting the stroke. So B FAST and Namaste are probably two things which one has to remember. So in simple words, stroke is a medical emergency similar to that of a heart attack. So why I relate it to heart attack is we understand it quite well. Heart attack happens when the block in the artery supplying the heart occurs. So similar thing, if it happens in the brain, that we call it as a brain attack, or the medical term for that is a stroke. And what we are concentrating now is talking about the ischemic stroke. As Dr. Abhishek has told us, there are two different types of stroke. The hemorrhagic stroke, where the bleeding happens, and the one where the blockage happens. So the B FAST mnemonic can be for any of these strokes.
In time, whatever that normal brain that was compressed regains, and whatever that part of it was damaged, hopefully the normal brain that is there takes up its function and the patient recovers to his best capabilities.
गुड मॉर्निंग। आज हम इकट्ठा हुए हैं स्ट्रोक डे अवेयरनेस के लिए। तो इसमें हमने यही डिस्कस किया है कि हिंदुस्तान का एक एक जना, सबको ये मालूम होना चाहिए, बच्चों समेत, कि स्ट्रोक के क्या साइंस होते हैं, कैसे उसको आइडेंटिफाई करना है, और जब स्ट्रोक आपको पता चले कि किसी को हुआ है तो कौन से हॉस्पिटल में जाना है। ज़रूरी है कि एक स्ट्रोक रेडी हॉस्पिटल में जाना है। स्ट्रोक रेडी हॉस्पिटल वो है जिसमें 24/7 साल के 365 डेज आपको सारी स्पेशलिटीज अवेलेबल हैं, जैसे कि न्यूरोलॉजी, न्यूरोसर्जरी, रेडियोलॉजी, इंटरवेंशन और सीटी और एमआरआई एक ही हॉस्पिटल में होने चाहिए, ताकि आपको एक से दूसरी जगह पेशेंट को लेके ना जाना पड़े। उसका पूरा इलाज एक ही हॉस्पिटल में हो जाए, रिहैबिलिटेशन तक। तो सारे साइन सिम्टम्स जब आपको मालूम पड़ जाते हैं, ऐसे हॉस्पिटल में जाइए जहाँ पे आपका पेशेंट का पूरा इलाज हो सके।
So, Dr. Abha nicely informed us what happens if there's a stroke and how to get treated. And let me talk about how to prevent such strokes from happening. So there are a lot of risk factors which we talked about in terms of having habits of, say, tobacco, smoking, and there are other common risk factors which we encounter in terms of hypertension, diabetes, the lipids being high, sedentary lifestyle habits which most of us have these days, and dietary habits. So all of these, if they are well controlled, one could probably prevent or delay such chronic diseases, including the stroke as well as the heart diseases. So prevention also becomes very important, and probably that is more important than having those active stroke treatments. But if there is a stroke, obviously, as Dr. Abha said, time is the one which is very important. B FAST is the mnemonic to remember. Again, balance, eye vision, facial weakness, arm weakness, speech problems, and T is time to act fast, and that is where the importance of time comes in. So prevention as well as treatment of stroke becomes important, and this we want to reinforce as a message on this World Stroke Day for everyone. Thank you.